Something to keep in mind when thinking about infections is the fact that every part of a healthy human body has some native species of bacteria, fungi, and even viruses. This healthy native population is called the microbiome, and they are species which can show up in a culture or PCR test. It is important to also remember that microbes don't come in two distinct categories: pathogens and non-pathogens. A species is not considered a pathogen until it starts causing harm to a host body, and even in that condition, it might be a species which was part of the healthy microbiome. This is one of the key reasons why it is wise to treat a wound with Heal Well gel. Even if microbial testing hasn't shown the presence of species of microbes that are considered to be dangerous and foreign to the human body. The use of Heal Well gel can be not merely a reaction to an infection, but a vital step to preventing infection. Sometimes a species of microbe, which is beneficial to a host body, can become harmful when something changes, such as a sickness or injury. In those cases, a bacteria or fungi can become what is called opportunistic, meaning that they take the opportunity to grow into a space which they were not previously capable of expanding into. For example, species which live natively on the skin can expand into the bloodstream following a puncture wound. On the other hand, when a population of bacteria are weakened or killed due to the use of antibiotics, the native fungi can grow into the areas which they previously could not grow into because they were stopped by the native bacteria. This is why a yeast infection can follow the use of antibiotics in some patients. The way this relates to wounds is in this: all wounds are contaminated, but not all wounds are infected. This is simply a way of saying that all wounds will have bacteria and fungi in them, as will every part of the human body. A PCR test can find the evidence of these species even if there is not an infection. Medically, a population of microbes is not considered an infection until the microbes begin to overwhelm the immune system, cause damage to the body, or, in the case of a wound, interfere with the body's ability to heal itself. Considering the fact that beneficial microbes can become opportunistic and the fact that a wound area is often ideal for the growth of bacteria, it should be assumed that an infection can and will arise in a serious wound if precaution is not taken. The stages which can follow a wound will be: first, contaminated, which is natural because of the abundance of microbes in and on every part of the body. In this context, contaminated means simply that microbes are present. Contamination can become colonization, which is where microbes build up their numbers and form colonies, which eventually leads to a change in their behavior. In an area like a wound, these colonies can form multi-species biofilms, forming an extracellular matrix which can be difficult for antibiotics to get through. Somewhere between colonies and biofilms, the populations of microbes become large enough that they can overwhelm the immune system and begin causing damage to the body. At this point, they are pathogenic. This is when contamination becomes an infection. Traditionally, culturing has been used to identify microbes, but modern methods of identifying species by their unique DNA has led to the development of PCR and NGS, which can be both faster and more accurate than older methods. Because of how sensitive these methods are, it is important to remember that all wounds are contaminated, but not all wounds are infected. It is likely that some microbes will be identified in every sample, but the number of microbes needs to be considered as well as their simple presence. A single bacteria may be of no concern, but a large population of bacteria is more likely to cause harm. It is also important to consider the condition of the patient, as the level at which microbes begin to cause damage is more complex than simply their having reached a certain number. The way to avoid allowing infections to form is to keep the wound area clear, removing any debris or dead tissue which might house microbes, and applying a topical antimicrobial which can hinder the growth of microbes so they don't have the chance to become pathogenic. If the microbes begin causing harm, physicians can use a combination of systemic antimicrobials and topical antimicrobials. Systemic drugs are taken internally, such as in pills or through IV. Topical are applied on the area of infection directly. Heal Well Gel is a topical antimicrobial, which is known to be effective against bacteria, fungus, mold, yeast, as well as both gram-positive and gram-negative bacteria, and various known strains of antibiotic-resistant bacteria. It is designed to deliver the antimicrobial PHMB to the applied area for a full 7 days after a single application. This keeps any microbes in smaller populations, allowing them to be handled by the immune system and keeping them from becoming pathogenic. It might not entirely eradicate microbes, such that a PCR or NGS test finds no evidence of them, but when used as part of a wound care regimen, it will greatly reduce the ability of those microbes to grow in number and become pathogenic. It should keep their numbers low enough that they have no ill effect on the healing process. In the case of an existing infection, the use of Heal Well Gel has been shown to be effective in reducing and even eliminating foreign pathogens. Because of its properties, Heal Well Gel is an important part of helping a wounded body return to its natural state of wholeness and balance, where it can live in harmony with its microbes.